Hi, this is Dr. Dean Tindall from New Life Naturopathic. I'm going to talk to you a little bit today about what we do with our nutritional therapy and our nutritional counseling. And actually what we do is medical nutritional therapy as a nutritional counselor. So there's basically 4 steps that we go through with our patients and clients to make it simple to understand. Number 1, our first step is assessment. So what we're doing is when you purchase a consult, our first step that we do is we try to gather your medical records, any labs. We send you out paperwork so we can get your case history. We do symptom surveys, we do brain surveys, health surveys, stress surveys. Basically why? Because we got to get to know you, we got to get to know what symptoms and health problems that you're currently having, because those symptoms and health problems give us an indication what nutritional deficiencies you have. For example, if we're a diabetic, we know that we need to work on some sugar handling problems. We got to work on the liver, the pancreas, things like that. If you're a thyroid problem, then we know we got to maybe ask for certain labs and that looks at your TSH, T3, and a bunch of other hormones that your thyroid makes, and then we need appropriate nutrition for your thyroid. Or for example, if you have a brain trauma. So there's lots of different things. So these different symptoms, signs, medical diagnosis, which is going to be different than nutritional diagnosis, gives us indications of nutritional deficiencies, what we need to do and focus on. And so that's where the assessment part comes in. And then what we do is a phone consult. That phone consult will last up anywhere to about an hour. We're asking lots of different questions, because why? Once we review this stuff, we're starting to get a working idea of what's going on with you. So with the phone consult, we'll talk to you, ask a lot more detailed questions to make sure, and then gather more information. Once we've gathered that information, then we kind of work into step 2. And this is where the kind of behind the scenes things. So in step 2, what we're trying to do is develop a nutritional diagnosis. Once again, it's different than a medical diagnosis. That's more for, I have this pathology, I'm going to do these drugs. And nutritional diagnosis is what's going on, what's breaking down, what physiology do we have to support, what lifestyle dietary recommendations are we going to make for our patients, what short-term therapeutic changes on diet are we going to make, because our long-term goal is to get you onto a real food diet. But sometimes you have to do short-term therapeutic diets, and each one's different. So for example, diabetes, liver problems, we're going to do a lot of vegetables. If we have an adrenal problem, we're going to actually up our protein a little bit, and of course a lot of vegetables. So what problem that you have is going to kind of give us an indication of lifestyle dietary changes. So what we're trying to determine, describe, and set a course of action for you. So we're going to do lifestyle changes, supplements. What kind of exercises do you want to do? So if we have a thyroid problem, we're going to do different exercises with a thyroid issue than you will with an adrenal issue. We'll do mental exercises, things to help you to reduce stress, things like that. So we'll come up with that plan, and then the third step of that is nutritional intervention. And so what nutritional intervention is once we get done with that, we send all of our recommendations to our clients, and we describe what their condition is. We'll talk about our plan of action, and then we do a lot of nutritional education. We're going to do monitoring with lifestyle dietary changes. How do we do that? We have you keep food diaries so we can analyze those. And that comes into our next part, which is the 4th part, which is monitoring and reevaluation. So what we're doing with the monitoring and reevaluation, since most people, it took decades, years and decades to get them sick, your body's going to take time to want to heal. So what we try to do is we're going to measure that progress. How do we do that? We reduce some of these symptom surveys. We measure the progress by talking to you. So we're going to ask different questions like, how's your digestion doing? How's your energy levels doing? How's your sleep quality doing? How are all these different things doing, and how are you progressing? Are we making forward progress? If we're not making forward progress, then what we have to do is reassess. So what we're doing that, okay, we're going to reassess, and then we'll have to adjust recommendations. And as certain areas get cleared up, say we get the thyroid problem straightened out, and that person may also have an adrenal issue or some reproductive issues or brain issues, because most people have more than one problem with them. Then what we do is support and then move on to that next issue. So we kind of come back again, we reassess, we work through this whole process again. And that's kind of what we do. So if you have any other further questions in regards to that, feel free to ask, and look us up if you want to get rid of some of your problems and get healthier again, then look us up at newlifenaturopathic.com, and we'll be willing to work with you.